si Salud Básica Internacional no hubiera encontrado a usted de que usted tiene cáncer, y si usted se hubiera dado cuenta de que tiene la enfermedad, ¿usted hubiera podido pagar el tratamiento?
No, no había alcanzado a pagarlo, porque uno de pobre no alcanza a pagar todo eso, ¿verdad? Porque yo considero también lo que ustedes han pagado, que no ha sido poquito lo que han gastado. Y por eso yo considero pues de que una enfermedad de esa, uno de pobre que no alcanza, mejor se muere, porque no tiene cómo pagarlo.
We are Basic Health International. Our mission is to eradicate cervical cancer in Latin America and the Caribbean. Since 1999, our organization has been working in El Salvador to establish a system of training and equipping doctors to prevent, diagnose, and treat the disease.
Hi, my name is Dr. Miriam Kramer. I am president and founder of Basic Health International.
BHI organizes delegations of international doctors to travel to El Salvador. We set up temporary clinics where rural women can get free access to basic women's health services. During these delegations, we train teams of local healthcare providers in low-cost cervical cancer screening and prevention techniques. By 2013, BHI will have established a cervical cancer prevention network throughout rural El Salvador. Cervical cancer was once the leading cause of cancer death for women in the United States. Over the past 40 years, the number of cases have declined dramatically due to widespread use of the Pap test. For the 3.5 million women living in El Salvador, cervical cancer is the #1 cause of cancer death. Living on less than $1 a day, most are too poor to afford even the bus fare to a treatment center, let alone the cost of a doctor.
Some of the conditions under which they have to work with are so extreme that even the simple fact of having electricity is not an option, of having running water is not an option.
By using a simple, low-cost examination, Salvadoran healthcare providers working in the most remote places in the country can detect the precursors to cervical cancer.
The long-term goal is to use our model as a turnkey to be able to have other countries be able to use this model to eradicate cervical cancer.
When precancerous cells are detected, they can be treated immediately with a routine, non-invasive cryotherapy procedure. The test, diagnosis, and treatment are done in a single visit. If a woman is detected with cancer, BHI covers the cost of her treatment and all necessary follow-up.
Instituting cervical cancer screening is perhaps the cheapest and easiest way of saving the lives of women in developing countries.
Pero posteriormente se ha dedicado más de lleno a la concertación, a darle el seguimiento con salud básica a todas las compañeras que han salido IVA positivo, ¿verdad? Por todo el quehacer que en la concerta se tiene, que trabajamos en todo el municipio de Suchitoto. Ahí no vemos colores políticos, ni de raza, ni de nada, sino la intención es ayudar y trabajar por el beneficio de las mujeres.
También la campaña que se promueve, que ya hoy estamos en lo que es la segunda campaña, entonces hemos logrado que 20 mujeres de la comunidad también este año participen. Entonces para nosotras es un logro muy importante que las mujeres puedan tener acceso a lo que es la salud sexual reproductiva.
Now, BHI is expanding to the entire country of El Salvador and extending our services throughout the Central American region.
My goal when I graduate from med school is, like she said, help here in underdeveloped countries and do something for people who really need help. I mean, be someone for those people that don't have the resources to be better.
Since 2006, we have screened thousands of women for cervical cancer. However, the most exciting thing about our program is that every day local Salvadoran healthcare providers are screening and treating the women of their country themselves.